Hi everyone, my name is Francesca and I'm an MS4 at UB. I'm here with the ENT PGY2s and they're going to talk about their intern year here at UB's ENT program, and I'll let them introduce themselves.
Hi there, I'm Jyothi Sharma. I am from Salt Lake City, Utah, and I did undergrad and med school there at the University of Utah. And then I came out here for residency. And I guess one kind of fun fact about myself is I really enjoy sewing. I like to sew clothes, but I also like to sew people's faces. So.
Thank you, Jyothi. So my name is Maddie Rossi Schumacher. As Francesca said, we're PGY2s here at UB ENT. I am from Troy, New York, which is just outside of Albany. I did my undergraduate training there as well at Rensselaer Polytechnic Institute. And I went to medical school here in Buffalo at the University of Buffalo, Jacobs School of Medicine. My fun fact is that I like to run in my free time. I play the flute and I like to paint. And my house is full of more than 20 houseplants, and I like to garden. So with no further ado, we'll get into some questions just to describe our intern year here.
Great. So the first question we have is, what was the structure of your intern year?
Yeah, so I'll answer this question. Our intern year is every ENT program has 6 months of off-service rotations and 6 months on ENT service. For us, we actually front load everything and we do our 6 months of off-service rotations at the very beginning of intern year. And this kind of allows us to have a nice chunk of time on ENT in the spring. So that really helps us. I think it's really beneficial because you get all of your off-service rotations kind of out of the way. You can use that to learn a lot of tips and tricks about like getting around the hospital and using the EMR and things like that. And then once you're on the ENT service, you can get more used to actually being an ENT resident and working with the team. So our off-service rotations include the trauma ICU, the trauma surgery with general surgery. We have 2 months of plastic surgery, and we have a month of anesthesia at the Children's Hospital. So we also tend to have another rotation that it varies by year. The ones in the past that we've had are neurosurgery, emergency medicine, and oral maxillofacial surgery. So these rotations are chosen and coordinated by the program director in conjunction with the chief residents. So although we don't get to choose our electives, the chief residents, I think, do a good job of figuring out exactly what is most applicable to us that would be interesting, but also have some overlap with ENT.
Great, thank you. And the next question we have are, what are the expectations of an intern at this program?
Yeah, so interns in our program are really just expected to learn how to function in the hospital. We kind of let you get accustomed to that gradually as the year goes on. We do work at several different hospitals, so we'll start orienting you to the EMR, how to put orders in, and just to do some basic patient care functions, ordering medications, and how to start triaging floor issues, if you get pages about your patients from nurses and things like that. We also want our interns to, while you're off service on trauma surgery or in the ICU, to start just thinking about how other services work, especially because we work a lot in conjunction with these services when we consult on these patients. So that's something that's important to take away from intern year. When you're on your anesthesia rotation, we expect interns to learn how to intubate, start placing IVs, become more expert at bag mask ventilation, start reading monitors. And then something that's very applicable to ENT, obviously, is start doing some direct laryngoscopy. And that's something you'll do on and off service. In general, an intern should start realizing how to be useful on the team, play a role when you're on and off service to help and further patient care. And then when you are on plastic surgery at ECMC, which is our county hospital here in Buffalo, you start to round with the ENT service. You start to learn more about how we take care of our specific head and neck patients or ear, nose, throat patients. So you get to work with some of our attendings during that time, even when you're off service. So it's a nice overlap there before you actually start on service with ENT.
Great. So you mentioned some of the services that you consult for. How have you learned to manage consults so far, and who teaches you?
Yeah, so usually while we're on service, the second half of the year as interns, that's when you start to see consults during the day. You'll start with just the residents who are on service at your specific hospital. You'll start to go with them and you'll see kind of how they interview the patient, certain questions they ask given what their chief complaint is. And they'll start talking to you about, this is why I asked this question, this is why I do my exam this way. And so they kind of start to train you, and you do basically on-the-job training. And then near the end of your intern year, you start taking buddy call to prepare you for second year. And usually they'll have you come in and start either seeing the consult by yourself, or if it's something that's a little more complex, you can get there and kind of see how they manage any overnight calls. You also, later on in the spring, after we take our in-service exam, you start becoming the first page for any floor patients as well as any new consults. So that also really helps us get used to kind of responding to questions, even if you don't always know the answers, your residents are close by, but you are more involved as a team player, and you really have to make sure that you understand the patients and you're keeping up to date with being able to see consults. So at some point, the residents will say, okay, you're getting more adept at doing this, and they'll trust you to go down there and start to see the consult, and then they can kind of come finish it up with you, and then you staff it with the attending. So we usually directly discuss all consults with our senior residents, and then with the attendings as well. It's nice to have that kind of connection and camaraderie between each other. There's not really any like hierarchical system. We basically are all as a team, like communicating together, like what our findings are, as well as what we think could actually be the management for the patients.
Great. We're going to move on to OR time now. So how often did you scrub into the OR during your intern year?
Yeah, I would say that's actually one of the big strengths of our program, and one of the reasons why I really wanted to come here for residency was because from every PGY level, even interns, you have a very high operative experience in this residency. You'll usually be in the OR at least 4 to 5 days a week. Here we cover over 20 attendings in total, and we rotate at 4 different hospitals. So there are often uncovered cases. So therefore there's tons of opportunity for everyone, all the way down to the intern, to scrub a case every day. And then we also do try to prioritize at least 1 clinic day a week or every other week, so you're not missing out on that experience as well. But being in the OR is something that you'll get really used to. And especially as an intern, you'll really get your suturing skills down very early on. Even on our off-service plastic surgery rotation, you really get those basic OR skills down. So you're really prepared by the time you get to second year, and you start to have a lot of autonomy at that point.
That's awesome. What kind of cases did you do as an intern?
So a lot of the time you are assisting as an intern, but we do a lot, like assisting doesn't just necessarily mean, oh, you're retracting and things like that. So we do a lot of assisting in our head and neck cancer ablation and reconstruction cases. We do a lot of assisting as well for like glossectomy and oral cancer resections, and thyroidectomies, parathyroidectomies, and any like neck mass resections. So there's a lot of time where you will be able to do like some of the suturing. They'll have you tie some vessels, and you're basically acting as a first assist with the primary attending surgeon. But there are some cases that we do act as the primary resident surgeon on, and those would be more kind of basic skills that you'll need to have for most of your other aura training. And so that's like direct laryngoscopy, as well as doing some facial trauma. So we're able to reduce nasal bone fractures, and we also assist in a lot of other facial trauma cases, such as any mandible fractures and zygomatic-maxillary complex fractures. So in contrast to some other programs, we don't have a lot of like pediatric ENT experience in our intern year. They mostly have us rotating at the other hospitals that we'll be seeing more consults. But then as we go to our pediatric hospital in our second and fourth year, you get to have a lot more autonomy, because they know that you've handled a lot of other cases at the other sites. And so as a second year, that's when you really start doing a lot of the primary cases, such as tonsillectomies, myringotomies, things like that. And so you're the resident surgeon, and you're able to do all those cases on your own. So although that's a little bit different from a lot of programs with our intern year, it's definitely worth it to wait, because by second year, you're able to do everything on your own.
Great. We're going to change gears a little bit and talk about program structure and strengths. So is there anything unique about the structure of UB's program?
Yeah, I can touch on that a bit. So I would say our program structure is somewhat unique in that we are a very resident-driven program, meaning that our senior residents, especially the chief residents, are in very close correspondence with our chair and program director in designing rotation schedules, call schedules, didactics, and dictating resident duties. So we have a big opinion weighing in on the kind of everyday things that we're doing, which is just really nice. And if there is any issues, the administration is very receptive to feedback and supportive of resident concerns. And those senior residents and chief residents are really good about, coming back to the junior residents and the interns and asking us if we could see any changes that would be room for improvement or any other changes that need to be made. So that's kind of nice that we get a lot of say in the kind of way that our program is run.
Great. The next question has to do with academics. How often do you have dedicated didactic time?
So we actually have a fair amount of dedicated didactic time. Monday nights, we usually always reserve an hour for specifically resident-led teaching from 4 to 5 p.m. So this is a very protected time, even in your off-service rotations. The chief residents let the off-services know, as well as it's kind of our responsibility to tell them, like, we have this resident didactic session, and so you're excused to go and attend that. And usually it's run by the chief residents, so they will determine what topics to do, and they can do anything from like a hands-on skill workshop to a worksheet to almost like sort of like Jeopardy style. So they try to mix it up and make it more fun and interactive in a way to study for the OTE, which is our otolaryngology training exam. And so as we get closer to that in the spring, they do more dedicated time studying for that exam. But for the most part, we just use it throughout the whole year to study for different topics. And then besides that, every Thursday morning from July to November, the junior residents have a lecture series on rhinology and rhinoplasty from 7 to 9 in the morning. And the senior residents will have their own senior review where they go over usually like dedicated studies, and they talk about clinical practice guidelines, things that may be more important for them who are closer to graduating, going into practice, as well as for doing their oral and written boards. So after we have this fall session in the spring, the rest of the year, kind of later on in the winter and the spring, we have grand rounds, and we'll have our M&M conferences, and that's from 7 to 8. And then usually after that, we have 1 hour of resident-led education again from 8 to 9. So usually at that time, since we've done a lot of our resident didactic teachings on Monday, we usually try to get guest speakers who come in and they'll teach us and give us lectures. So we'll do it on head and neck radiology, or we'll ask like a neuro-otologist. Especially in this day and age, it was so great to have Zoom because we were able to get a lot of people who were able to still give us presentations and give us that information all from our computers. So it was really nice to have that and get to see a lot of different perspectives from people from different programs.
Great. The next question is along the same lines of academics. Did you have time to pursue research during your intern year?
Yeah, so our intern year is pretty nice, especially when you are on service, that your schedule is pretty flexible and you have a good amount of time, especially on the weekends, to pursue activities, whether it be research or something else that you're passionate about. Here at UB, if you are really passionate about doing research and you seek out an opportunity and identify a mentor, that's definitely supported here, and you can find resources to conduct research. This year I was able to get involved with a few projects with some of our attendings and to do more like data-driven research. And I got an IRB approved, which obviously, as you know, that takes some time. So that'll be something that's ongoing into my PGY2 year, but was able to get that off the ground as an intern. And then it's nice here, we're associated with the medical school, and we're able to get a lot of help from the medical students to work on projects together and have them help with data collection and do some mentorship in that way as well, if you are interested in the more academic structure. I will also say that being said, our program does really allow you to create your own experience here. So if you're someone that's not super passionate about research, or you would really need a lot more guidance on that, you can kind of try to partner more with our attendings that are more interested in research to get more guidance. Or there are some people that are just not as interested and they kind of wait until the dedicated research block, which we have during our PGY3 year for 3 months. So it really is what you make it. But yes, there's definitely time for it if you want to pursue it all throughout residency.
Great. The next question is about the residents as a group. So how do the residents get along, and is there any time for resident bonding events?
Yeah, so this is a great question. I think this is something that really drew me to the UB program. We all get along extremely well together, and we're all, not only are we colleagues, but we're very good friends outside of the hospital. Since our program is a little bit smaller, we all have to be like very trusting and very reliant on one another. And it's really like a big team, a big family. And so we like to have events at each other's houses. So we usually we'll do a wine and cheese night, or we like to go to trivia night at some of the local bars. We'll have like a barbecue. Some of the specific resident bonding events that we have is we have a ski weekend every January for Martin Luther King Jr. weekend. We usually have a speaker there, and then we will all ski together with some of the attendings. We have the intern welcome party every year in the summer. There's the graduation dinner and sometimes graduation events celebrated with that. And then one of our residents, Phil, likes to really smoke and barbecue meat. And so he has something he calls Meat Fest, which is basically just a big barbecue, and everyone comes over usually at the end of summer, beginning of fall, and we hang out for that. So it's pretty fun. I think we all get along really, really well. And there are so many people that still keep in touch over the years with other residents. So.
Great. And then last question is for preparation for prospective interns. So it's common for a lot of MS4s to feel nervous about the new responsibilities of being an intern. What advice would you give to prospective interns about this transition?
Yeah, so I would say you just need to remember that we have all been here before, and it's okay to feel nervous. It's okay to feel a little overwhelmed. It is a big transition. You're going from being a student to all of a sudden you are the physician, you are in charge of this person's care, and you're kind of the first person who's going to see them and help take care of them and make sure that things are basically that things are what they're supposed to be. And so just remember that you're not the first and you're not the last person to do this. So it's okay. You just need to remember that you will make progress as you keep going. Mistakes will be made, but there will always be people to back you up. You're not going to be solo doing this on your own. You'll have residents, you'll have attendings. So it's okay to realize that you don't know everything. This is what your residency training is for. And so just take that in stride and make sure to just learn from your mistakes and to use that as a way to become a better physician. But also just make sure to pay attention, be proactive. As a med student, you should kind of already be doing this for your sub-Is. So then just kind of transition that more into being an intern. It just kind of will help the flow a little bit easier. But at the same time, make sure that you keep up with your wellness, keep your natural passions and curiosity, and be able to just channel that motivation to study, to do well in the clinic, to do well in the operating room, and just continue to work on being present as well as learning and being an active member of the team, and you'll be fine.
Great. And then last question is, do you have any tips or advice about applications, interviewing, that whole process?
Yeah, I'd say, as far as being an applicant and interviewing, I would just be sure to make sure that you know details about the program that you're interviewing at. look up common questions that are asked and have an idea of how you'll answer them. Make sure you practice out loud, or record yourself and play it back, and you can figure out, how you look on Zoom, since I'm sure that's still going to be in place for this season. Make sure you know yourself and your CV, the things that you wrote on your ERAS application, and make sure you're able to talk about everything that you've written down. Pick out a few of your favorite things and have a little elevator pitch that you can say about those things. And in the same vein, have an elevator pitch about yourself, since the most common question you're going to get is, tell us about yourself. So have something to say to answer that. And then specifically for each program, have an idea of why you want to go there specifically. Why should they accept you? Why would you be a good resident? Why would you be a good ENT? Those are things to just keep in mind and kind of self-reflect and kind of incorporate those kind of things into answers to other questions that you have. And then in general, just try to be somewhat strategic in having, as much information as you can about the people that are interviewing you. If there's something that they do that you really like, try to bring it up. I see you do research on X. I'm really interested in that. Can you tell me more about it? Just anything that can kind of help you make a personal connection when you're talking to someone, and that may help someone to remember you. The goal of every interview, once you do get it, is to just make sure that those people remember you and that they have some motivation to advocate for you when they're making their rank list, because your whole goal is to get high enough to match on that rank list. So just, try to leave something in every room that someone can try and remember you by. But otherwise, just stay relaxed, have good positive energy, speak with a strong voice, try not to say, oh, like I'm doing right now, and you will be great. So just practice and stay confident, and good luck.
Thank you both so much. It was really helpful. If you have anything else you want to mention, feel free. If not, I think we're all set.
Okay, great. That sounds good. Thank you, Francesca.
Yeah, thank you.